Thank you. This is David Lee from Prevent Connect, and thank you for joining today's Prevent Connect web conference, Stop SV, a technical package to prevent sexual violence. This is a very important topic, and I'm very excited to have our guests here today to talk about this resource that I think is going to be very helpful in supporting sexual violence prevention practice here in the United States, and I think throughout the world. I actually was just speaking to a group in Israel and sharing about this package, thinking that it has much that we can learn from. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, the CDC, or Calcutta. The objective of today's session is that by the end of this web conference, participants will be able to describe the 5 strategies highlighted in the technical package, identify resources to support prevention decision-making, and to be able to identify potential sectors to involve in sexual violence prevention. As I said, I'm very excited about our guests that we have, and so from the Centers for Disease Control and Prevention, I'm really pleased that we are joined today by Jim Mercy, who is the Director of the Division of Violence Prevention at the Centers for Disease Control and Prevention. How are you doing, Jim?
I'm doing great, David. Thanks.
Well, thank you very much, and really glad to have you. And we're also joined with Kathleen Basile, who is also at the Division of Violence Prevention, who helped lead this, was part of the team and putting together this great Stop SV technical package. How are you doing, Kathleen?
Great, David. Thanks.
Wonderful. It's great to have you join here. And so, wonderful. And then we also are going to be joined from many of our partners from the National Sexual Violence Resource Center. And so I'm really pleased to have joining us again Sally Lasky. How are you doing, Sally?
Just fine. Glad to be here, David.
Great. And I am very pleased to have, formerly of Prevent Connect, but now at the National Sexual Violence Resource Center, Chad Sniffen, joining us now as a guest on a web conference, not a host, as he has done many times. Chad, great to have you joining us.
Great to be here, David.
Thank you. So it's great to be able to have all of you here, and I want to highlight that the National Sexual Violence Resource Center has put together a page that has just gone live today. That's called it's their resource page around Stop SV. And so you'll see all the resources that Chad and Sally will be talking today. They will have links to those resources available on that page, and that is going to be a growing page. As more things come in, they'll be adding to that, including as we will be asking you for suggestions of resources, we'll be drawing from those also to be able to add to them. So I want to encourage you to be able to get that great resource. But the resource we're here to talk about today is the Stop SV technical package, and you can see and Ashley will probably has already put the address into your text chat. And so I want to ask a question of our audience, is how familiar you are with this technical package. And so we'll start with A, B, C, or D in the left-hand corner. We know that if you signed up for this web conference, you had to know about it at least, because that's why you signed up. A, you know about it. B, if you've at least skimmed it. C, you've actually read the entire package. And D, I want to know if you've actually used the technical package in your work already. And so let's just get a sense. And so Ashley, let's look at what's, I'm going to share the results, and half of the audience is familiar with it. We've got about a third of our audience has skimmed it. About 11% of our audience has actually read the whole thing, and 4% of the audience have actually used the technical package in their work. That 4%, we're going to want to come back to you and know how you've done that to help inspire us. As I said, I actually have been already including this in my presentations that I'm giving to highlight the strategies and approaches to be able to use. And so something that I have already been finding very useful in the work that I have been doing here at Prevent Connect. CDC also is releasing just today. It came out, and I will get the address to you. It's on the CDC website. I don't think Ashley, I think doesn't even have that yet. It just came out, as I say, it just came out today, so I've got it here, an infographic on this. And so what I'm going to be able to do is, I found the address. I have to go do a little trick way to post it into the piece here. And so this infographic, I have it broken into 3 parts around this. that's on here as a preview. They'll be sending emails and distributing this widely, if not yet, very soon. This will actually highlight the different strategies that we have in the Stop SV package, as you can see, and that they will also have encouraging people to be able to take action now and having everyone being part of the solution. As we were preparing for this, as you're doing this and having the discussions in this, I was reflecting on the changes that have happened in the last, since 2004. In 2004, the Centers for Disease Control and Prevention released Sexual Violence Prevention Beginning the Dialogue. And here we are now in 2016, and in those 12 years, I think we have really gone from beginning the dialogue to actually a place where we know quite a bit, and that we have that there's so much more that we have learned. That doesn't mean we have a lot we still don't need to learn and will continue to learn in the next years. But this really, the Stop SV technical package to me really speaks to the maturation of our knowledge and be able to do this to advance how we are going to do our work to prevent that. And so it's something that I find very powerful and meaningful, and it is great that we'll be able to present this today. So what I'd like to do is have Jim Mercy be able to say a couple words just as an overview about the technical package. Jim?
Thanks, David, and thanks so much to Prevent Connect for hosting this webinar. Good day to everyone. I just want to take a few moments to share why we at CDC think this package is so important and why we hope it brings us together to redouble our efforts to stop sexual violence. The first reason is, this package touches on values that most of us hold dear, values that hold and I think create common cause. One such widely shared value is that every one of us should have the opportunity to live out the full potential of our lives, especially our children and youth. But we know that exposure to sexual violence negatively impacts healthy, optimal development. It undermines the very possibility of living out our full potential. Another widely held value is that we all have a right to our own personal autonomy and control over our own bodies. Again, exposure to sexual violence by definition violates this widely and deeply held value. And I also believe that this package speaks to our value for collective responsibility. That is the belief that preventing sexual violence is not just a responsibility for us as individuals, but something that we should work towards achieving collectively as communities, as states, and even as a nation. Aside from these deeply held values, the second reason this package is important, we believe, is that sexual violence is an urgent public health problem. As we all know, it's urgent because it affects a lot of people. About half of women experience some form of sexual violence during their lifetime, and about 1 in 5 will experience rape. It's also urgent because sexual violence disproportionately impacts adolescents and young adults. About 80% of first-time rapes occur in women less than 25 years of age, and 40% among girls less than 18 years of age. This is important because it's impacting these youth and young adults during periods when their brains are still developing and vulnerable to damage that contributes to mental health and physical health problems, including depression, HIV, diabetes, heart disease, and even cancer across the life course. The cost of sexual violence is largely hidden from view, but everything we know points to the urgency of lessening its impact. And finally, this package is important because of its urgency. We need to take action now to prevent sexual violence. We can't wait for perfect solutions. As David says, we know quite enough to take action, but we need to take action using the best available evidence and to learn as we go. That is, use the best available evidence, test it, and improve our efforts as we move forward. This package is intended to support the need to take action now. It's intended to guide states and communities who want to take collective action to stop sexual violence. So I just want to thank all of you for joining this webinar, and thanks for your dedication to stopping sexual violence now.
Thank you, Jim, so much, and I really appreciate that. And and indeed, I really agree that it's such an important that we are here actually an audience of people that are taking those actions, and we need to be able to draw on the lessons of what we've learned, give us this guidance to be able to where we move forward, and then we need to continue learning to continue to improve the work we do. So I'd like to now introduce Kathleen Basile, who's going to, Kathleen, you're going to sort of talk about the technical package and what it's in there, and then we'll be coming in with some of the resources that Chad and Sally will bring from the National Sexual Violence Resource Center. So go ahead, Kathleen.
Okay, thank you, David, and thank you, Jim, for that introduction. I wanted to start us off with a definition of what we at CDC mean by a technical package, so we're all on the same page as we go through this webinar. So for us, a technical package is a select group of strategies based on the best available evidence to help communities and states sharpen their focus on priorities with the greatest potential to reduce sexual violence. So a little bit about the benefits that we see in technical packages. Technical packages are actually a priority for CDC. Our CDC director, Dr. Tom Frieden, outlined technical packages as one of 6 key components for effective public health program implementation. So not only do they help us sharpen our focus, but they also help to avoid kind of a scattershot approach by using a large number of different interventions, some of which may not be that effective or may have a small impact. So these are the steps we took in developing the Stop SV technical package. First, we reviewed the prevention literature and considered the best possible evidence available to identify a select group of strategies. So we started with identifying strategies to prevent sexual violence outright or to lessen the harms and prevent future risk. That led to us identifying approaches under each of the strategies that states and communities could implement to advance the strategies. And we also described various sectors that could help support the implementation. So then we pulled together a draft narrative, and at different points we got feedback. But before the finalization of the narrative, the package was reviewed by various groups, grantees, funded partners, federal partners, and other partners and other audiences. So the final package, as David already shared, looks like what's here on the screen. A little bit about the structure of the technical package. So within the package, you will find these primary components. As I alluded to, the first component is the strategy. So what we mean by that is the preventive direction or action taken to achieve a goal. And in this case, the goal is preventing sexual violence. The second component includes the evidence-based approaches. So the approaches are under the strategies, and these are simply ways to advance the strategies. And then within or under those approaches are example programs, policies, or practices. These are simply examples. There may be other examples, but we included 1 or 2 examples. These are selected based on the evidence and the population impact on the problem of sexual violence. So I'll get a little bit more into that in a moment. So these, what you see here on this slide are the considerations that we had for including the examples that I'm talking about. So we selected evidence-based programs, policies, or
Excuse me, Kathleen, for 1 second. We're getting a little bit of sound. I'm going to mute all the lines for a second and have you unmute your line because I think we're getting someone's other sound.
Okay.
All guests have been muted. You can unmute your line by pressing *6.
Hi, Kathleen. You'll need to unmute your line, but I want to make sure we didn't get that background sound. Are you back on, Kathleen?
Yes. Can you hear me?
Yeah, just a little bit louder.
Okay.
Great. Thank you.
All right. So as I was saying, we selected the evidence-based programs, policies, or practices based on the considerations that you see here on the slide. And just so you know, these considerations were used for all the technical package that we've developed or are in the process of developing in our division. So as you can tell, we selected programs based on the best available evidence, as I've been saying. Ideally, we looked for evidence of impact on sexual violence outcomes. But when there was not that kind of evidence, we looked for evidence of impact on risk and protective factors for sexual violence or other forms of violence that may co-occur with sexual violence, which may suggest it would have an impact on preventing sexual violence. So, and then other factors or considerations, of course, no evidence of harmful effects, feasibility in the United States, et cetera. So if you haven't taken a look at the package, the full narrative is fleshed out. We've kind of fleshed out who would take the lead on the various strategies and approaches. So in some cases, it may be the public health agency or public health department directly implementing, or it could be in collaboration with other sectors, or it may be that other sectors besides public health would take the lead. So the bottom line that I want to share here is that this technical package is not just for public health, it's for the field. So it's not just for our grantees. We designed it with the field in mind, not just who we typically fund or who our grantees are. So the full narrative, and I'll talk about this briefly later on, but the full narrative also includes a section on the importance of monitoring the problem through surveillance, public health surveillance, where we count and monitor the problem, and also evaluate the impact of the approaches. So I'll talk more about that in a few minutes.
Oh, my God.
Okay, I'm getting someone who has unmuted their line, so I'm going to have to mute the lines 1 second.
Oh, Jesus.
All guests have been muted. You can unmute your line by pressing *6.
Please do not unmute your line unless if you are a speaker. I did get someone making comments in the background, and so we want to be able to hear that. So Kathleen, are you back on the line?
Yes, I am. Can you hear me
Thank
okay?
you. Perfect.
Okay, so this slide, this is a summary of the strategies and approaches in the STOP SV technical package. You see the strategies there on the left and the approaches on the right. The strategies all start with a letter from STOP SV. So we have promoting social norms that protect against violence with the approaches of bystander approaches or mobilizing men and boys as allies. The second strategy is teaching skills to prevent sexual violence. Here we have 4 approaches: social emotional learning, teaching healthy and safe dating and intimate relationship skills to adolescents, promoting healthy sexuality, and empowerment-based training. The third strategy is opportunities, so providing opportunities to empower and support girls and women. Here the approaches are strengthening economic supports for women and families, and strengthening leadership and opportunities for girls. P is protective environments, so creating protective environments through the approaches of improving safety and monitoring in schools, establishing and consistently applying workplace policies, and addressing community-level risks through environmental approaches. And then SV is support victims and survivors to lessen harm. So here we have the approaches of victim-centered services, treatment for victims of SV, and treatment for at-risk children and families to prevent problem behavior, including sex offending. So in a few minutes, I'll walk through each of the 5 strategy buckets and give a little bit more detail on what's included in each of them. And this is just another visual of the 5 strategies that I just outlined, our CDC infographic that shows kind of visually how the strategies can work together to stop SV.
Great, and Kathleen, I'm posting into the where people can actually get this infographic, and we'll also put it onto the Prevent Connect page associated with this. And I know I have to, so that's going out right now.
Okay, should I continue?
Let's go ahead and let's start with strategy 1. Let's start with S.
Okay, so first strategy is promoting social norms that protect against violence. And here, as I mentioned, are the 2 approaches. So we're talking about peer norms here, influencing relationships. So social norms, we think these are important because they serve to define appropriate and acceptable behavior. Gender norms define appropriate behaviors for men and women or girls and boys. So here we're focused on, as I said, 2 approaches. The first is bystander approaches. This is, as I'm sure most of you know, engaging witnesses not just to change acute behavior, to intervene in acute cases where sexual violence may happen, but also to change social norms and provide peer leadership around nonviolence. So there's some evidence in both college and high school or younger ages of impact of these types of programs on not just types of sexual violence, but also on efficacy to be a bystander and intentions to help others and things of that nature. So the examples we give here are Green Dot and bringing in the bystander that have shown to be impactful for some of these SV outcomes and other related factors. The second approach here, mobilizing men and boys as allies. This is fostering healthy, positive norms about masculinity, about gender, so we're talking gender norms here, and about violence or nonviolence. So the idea here is engaging men and boys in prevention, and the example, coaching boys into men. This is just one example where they engage high school coaches and they give them tools to model and promote respectful, healthy relationships with their athletes. And so that has been shown to be effective. Just one example there.
Great, so let's move to Chad and Sally.
Wonderful. Well, I have to say it's really exciting to be together with almost 250 people, with our partners at the CDC and Prevent Connect, to be talking about where we are and where we've come from. I know just recently, and I think this is happening more and more often, wherever I am, people are talking about using engaged bystander intervention skills. I know the media is now beginning to talk more about and cover this as a story, as the prevention, as an option of a prevention story. Chad and I are going to talk a little bit about resources that we have collected around these different approaches to prevention that are being talked about via the technical packet. And the first is around engaging bystanders. So we have been, as a field, really engaged in training and education of potential bystanders and working on skill development, but also those social norms, behavior changes, and really looking at shifting social norms for quite a while. We've gathered a variety of tools related to organizational capacity building all the way to individual skill building. In addition to some e-learning tools that include online courses and scenarios, Prevent Connect has a variety of courses and archive web conferences on key issues related to bystander intervention. We have guides for advocates. We have an online collection, and as David mentioned, and you can see at the bottom of the slide, we are building and will be adding to this entire collection of resources to support the technical packet. So at nsvrc.org/shop-SV, you'll be able to see a lot of the things that we just discussed. I do think that a lot of you on the line might be interested in an archive of an exchange forum, which is an online forum that was actually a live forum, where we had Dr. Vicki Banyard on to talk with all of us about the research developing around bystander intervention. So I'd encourage folks to take a look at our resource page and check out that archive as well. And I will turn it over to Chad.
Hi, so very happy to be here. So another collection that we've put together covers the strategy of mobilizing men and boys, and mobilizing them in healthy, positive ways, in ways that promote positive norms about masculinity, gender, and also men's and boys' use of violence and attitudes about violence. So the collection that we have at the moment, and as Sally said, that we will be expanding this SV technical package collection over time as more resources come to us. And as you as attendees and as people in the field tell us about more resources, good resources that you find useful. The one that we focus on the most right now in the section is Coaching Boys into Men, which is a project that I'm sure most of you are familiar with, that is produced by Futures Without Violence. And we have 3 different types of resources for that. A webinar recording from the Washington Coalition of Sexual Assault Programs, as well as links to Prevent Connect's own webinar series, a 3-part webinar series that if you visit the collection, our collection, and then visit the Prevent Connects page, you'll see a recording for Part 1, which has already happened, and links to Parts 2 and 3, which are still yet to happen. And so those are right now what we're focusing on in that section. But we also have a link to another collection that we have developed with the National Resource Center on Domestic Violence, and it's hosted at VONNET. That is actually a very extensive collection of engaging men and boys resources. And it's actually a little too extensive to talk about, but you'll find a lot of good stuff there when you visit the page. Thank you, Sally.
Great. Well, thank you, Chad. And I just put a link in. We actually did have the second part of our series with Futures Without Violence on coaching boys into men. And it's actually a full train the trainers that we're doing as the web conference series. So it's a really great resource that's available around this program. But we want to be able to draw on not just what CDC has identified that met their criteria, and not just the ideas that NSVRC has, but really draw on our audience. So we'd like to know, what resources are you familiar with in using this strategy and approach? So around shifting social norms, particularly the approaches of bystander and engaging men and boys, we'd like to get a sense from the audience of what are some of those resources and those tools, because we know that there's different pieces, and I know there are different levels of what evidence around each of those are, but we want to be able to draw on what those are so we can get experience and learn from each other. And so go ahead and write into the text chat and see. Someone was saying that coaching boys and men is designed for high school. That is true, though there is some work on doing adaptations for college and other age that's going on. And some people have used, we use two different approaches, someone said, and where do you stand, I've seen come up. Many are doing green dot. Men as Peacemakers in Duluth has been active in changing norms, particularly with coaches and athletes. I see a lot of people have been doing green dot and coaching boys into men. Safe dates, we'll actually come to safe dates when we get to the next strategy and talking about actually more around teaching the skills. Wendy talks about Can I Kiss You, the work. Where Do I Stand, which was created by Men Can Stop Rape. Many people are using. Jen, you wrote BITB. Can you write out what that acronym stands for? So everyone can, including me, understand that. There's bullying preventions that have bystander work, positive youth connections, thank you. Bringing in the bystander is what that is, and that's out of University of New Hampshire, where we've seen some of the work there, and some youth violence prevention work and media literacy work. So some of this is going to see. I'm noticing, Kathleen, as I'm reading this list of resources, and same with Chad and Sally, that some of these might fit one strategy, but also might be fitting in another strategy that we're going to be talking about. So that's a piece that we might want to highlight. And so thank you for doing this. It's great to be able to get this list of resources. Rebecca raises an important issue. We need resources for the LGBTQ community. I think that's really important, that programs have to be tailored toward, developed, and or adapted to do that. And notice that Prevent Connect recently has done 3 web conferences on looking at how to be working with LGBTQ communities and doing programs that are not reinforcing the gender binary or heteronormative in our sexual violence prevention work. So great, thank you. That was a really great discussion. So Kathleen, let's move to the T in STOP, in stopping SV.
Okay, thanks, David. So this is our second strategy, T, teaching skills to prevent sexual violence. So here we identified several areas for which skills seem to be important. Under this strategy, we're highlighting 4 approaches. 2 are here on this slide. The 2 on this slide, social emotional learning approaches, and these are geared toward improving communication, problem solving, and other similar skills. And then the second approach on this slide is focused on healthy, safe dating and intimate relationships. So the social emotional learning, other problem-solving skills, empathy, these have also been used to try and reduce bullying and other types of aggression in childhood and early adolescence. The example we give here is Second Step, which was in middle schools and was effective in preventing bullying and some types of sexual violence as well as other types of aggression. And then for the healthy and safe dating and intimate relationships, the example we give here is Safe Dates, This and other similar programs are building skills and expectations for caring, for respect, and for nonviolent behavior in relationships. And so Safe Dates, as many of you know, has been shown to be effective in the 8th and 9th grade and sustained over several years. So those are just a couple of examples. Moving to the other two approaches under this teaching skills strategy, there's also empowering healthy sexuality, and this is essentially through comprehensive sex education. And then the fourth approach is skills that are geared toward empowering potential victims to assess risk and act to prevent sexual violence. So that's the empowerment-based training. So for promoting healthy sexuality, some of these programs, examples under here, involve parents and children, and it's kind of comprehensive sex education. It's addressing sexual communication, sexual respect. It addresses consent, and so it's a comprehensive type of program focused on sex education. The examples here, SAFE, or Strong African American Families, and Safer Choices. Both of these examples are examples of approaches where there's not yet impact in the literature on sexual violence behaviors, but there is impact on many factors that we know are risk factors for sexual violence. So early involvement in sex, high-risk sexual behaviors, not using a condom, other high-risk sexual behaviors like that, safe sex, et cetera. So those are just a couple of examples where the impact is on risk factors for sexual violence rather than sexual violence itself. And then for the empowerment-based training, the example we give here is EAA, so it's Enhanced Assess, Acknowledge, and Act. This is a program out of Canada that showed after a year that there was less rape in the intervention group than the control group after a year follow-up. So this and other types of programs in this category strengthen women's ability to assess risk for sexual violence, not just in relationships, intimate relationships, but also in other situations and with other types of potential perpetrators. And these types of programs empower them to act to prevent it. So it's not just self-defense, it's also other training around empowerment. And so that example, Enhanced Assess, Acknowledge, and Act, is just one example.
Great. Well, thank you, Kathleen. So, Sally and Chad.
So back in 2012, the theme of Sexual Assault Awareness Month that the NSVRC chose to focus on was actually healthy sexuality. So we have quite an extensive collection of healthy sexuality resources built up. So on the Stop SV page, you'll see that we do highlight the Native Youth. We do highlight one other program right now. We're looking forward to highlighting more in the future as we become more aware of them and also as we have more time to develop the page. But already existing are a number of resources that come from there. So we have a general collection on healthy sexuality and various guides. Also, we have in development an I Can Relate mobile app, which Sally might say a little bit more about in a minute, which is a mobile app to encourage youth to learn about healthy sexuality and healthy sexual practices. Sally?
Yes, thank you, Chad. I'd love to talk a little bit more about the app. David mentioned, as we were seeing through the chat, there are a lot of approaches that bridge some of these different strategies. And what we have done in this new mobile app, which will be out this summer, and we will be actually presenting on it at the National Sexual Assault Conference at the end of August in D.C. We've actually brought together skill-building information on healthy sexual development and bystander intervention skill development and partnered those together. This is an app that's been developed for youth, although there are many sections that can be used together with parents and guardians and adults that are wanting to engage with the youth in their lives. I know that someone mentioned in the chat how hard it is for them because they're not able to talk about sex or sexual assault or rape within their school systems. That's one reason why we really focused a lot of the language and the name of the app being I Can Relate. So it's really about relationship building, whether that's relationship building with yourself, with your peers, or with the adults around you. So we're really excited for this, and we look forward to your feedback once it's released.
Okay, great. Well, thank you, Sally. So once again, let's go to our audience. And what resources are you familiar with using this teaching skills? And we'd love to get draw from the audience here. What are the resources are you familiar with? Someone wanted to know, Carol wants to know when I Can Relate is released, and that we, Prevent Connect, will let people know, in the National Sexual Violence Resource Center will let people know when that is going to be released. It is this summer that it will be coming out. And so we're now getting back to resources, and so I'm seeing Our Whole Lives, a comprehensive sexuality education program across the lifespan, Second Step and Safe Dates, which have been talked about, Love Notes 2.0, Shifting Boundaries, which we'll actually be talking about the later on in the building style intervention later on in creating protective environments, Discovery Dating, Prevent Child Abuse Vermont, Safe Tea, Care for Kids. I'm trying to get all of these different ones. Girls Circle, Rape, Aggression Defense, Self-Defense, that some people have done. Stacey Haynes' book on sexuality for survivors of sexual violence. Expect Respect, Empowerment Self-Defense. So I'm seeing Power Up, Speak Out. So I'm great seeing, so Sally and Chad and Kathleen, I am seeing many examples that are living here. Leslie talks about using a Call to Men's Live Respect program, which might be part of the first strategy, having both teaching skills and also about engaging men as allies that was being discussed. So great, Streetwise to Sexwise, Child Safety Matters, ChooseRespect.com. So great, thank you all for sharing the resources with each other. And that this will help inform these lists. So let's go with Kathleen. Now in our tour of Stop SV, we are on O for opportunities.
Okay, thank you, David. So this is the third strategy, and this is a little bit more macro, as you'll see. This is providing opportunities to empower and support girls and women. This strategy is intended to strengthen economic support and enhance leadership opportunities for both women and girls. And the idea here is to address poverty, economic insecurity, power imbalances between women and men, or gender inequality, which we know have been shown to be risks for sexual violence. So we have two approaches here, which we think work together to increase economic independence and decrease gender inequity or inequality, and will in turn make girls and women maybe less vulnerable to sexual violence. That's the theoretical link here. So the first approach, strengthening economic supports for women and families. So like I said, these are supports to address poverty, to increase economic security, and decrease power imbalances between women and men. We have three examples here, and these, again, are just examples, but they kind of highlight what we mean by the economic support. So the first is comparable worth policies. These essentially mean equal pay for women and men for work of equal value. So there has been some evidence that these do increase annual earnings, they increase income, and poverty rates and human capital, so things like that. Another approach or example under this approach is adequate work supports. What we mean here is things like affordable and good quality child care, and paid family leave. The idea here is to increase mothers' labor force participation and decrease negative mental health symptoms. So the idea is to keep women employed, if they have a child, or if they need child care, or if they need paid leave to go on maternity leave and things of that nature. So there has been some impact shown for these types of programs as well. And then the other example here is microfinance. These initiatives have largely been tested in the global context, but the idea here is to provide loans and savings opportunities for low-income households, mostly women and children, and the idea is to improve the financial and social status of women and their families. So these, again, there's some suggestion in the literature that they're effective in reducing these risk factors that then can lead to sexual violence. And even in some cases, they've reduced past year sexual violence and intimate partner violence. So moving to the second approach under this strategy, strengthening leadership and opportunities for adolescent girls. This is focused, as you can see, on adolescent girls as opposed to adult women. These are programs and policies that aim to build confidence, to build knowledge, to build leadership skills, and in turn to improve education and employment outcomes. So with the idea that these would make women and young girls less vulnerable to sexual violence. So the example here we have is Powerful Voices, which has had some success in improving school success, improving job skills, and things of that nature that we know are risk factors or are related to sexual violence victimization.
So, Chad and Sally.
Yes, I am so glad that we have the opportunity to talk more about economic justice issues. When looking at strengthening economic supports for women and girls, I think we need to look more closely at the connections between economic justice, anti-poverty work, and sexual violence prevention. I know in my initial training as a prevention educator and victim advocate, this wasn't necessarily the groundwork that was laid for me in approaching this work. I am very happy that I was able to connect with folks at the Pennsylvania Coalition Against Rape around their economic advocacy project that they developed. We've included a link on our resource page to their guide, which is really one of only a few that looks specifically at the connections between sexual violence prevention and economic justice work. So they use the model of the spectrum of violence prevention to develop this guide to have a more comprehensive economic justice advocacy approach to prevention strategies. I also think it's a helpful tool just for us to look at our own organizations and what do our own policies look like to support the economic justice issues that have been talked about already connected to the technical package. We've also been partnering with some researchers looking at the cost of sexual violence, and you can find links to those podcasts with Dr. Rebecca Loya. That's been really looking at the issue of economic justice from childhood through later life. And I think if we can keep having some conversations, we can develop some more tools. And if folks have developed policies within their own organizations around this, we would love to see those, and we would love to be able to help develop a collection to share with others.
And along with those economic supports, there are so many wonderful organizations doing leadership work with and providing leadership opportunities to girls and women. And so we just highlighted a few of them on the resources page right now. We're looking forward to adding more. A Long Walk Home is one of them. They have many wonderful programs, but their Girls Friends Leadership Institute is one of them, so we have a link to that. Monsoon United Asian Women of Iowa does fantastic work in a variety of ways, and I know they've been guests on Prevent Connect many times and have contributed many resources to the field. Powerful Voices Girlvolution, which is an annual girl-led, youth-led social justice conference that happens every year in Seattle. We have a link to their Facebook page and their other information, as well as something I mentioned before, Student Leaders in Athletic Youth Adaptation of Coaching Boys into Men. So that's a cross-gender adaptation of Coaching Boys into Men that that the Washington Coalition of Sexual Assault Programs did a webinar on.
You want to say something about the White House Council on Women and Girls?
Yes. I think Sally can talk a little bit more about that.
Sure. You know, we were very pleased in 2009 when the council was created, and we're seeing more and more an increase in policies and programs that are supporting the growth and development of programs that support women and girls on the federal level and locally. So we just wanted to connect on the synergy that we see happening, and knowing that there'll be more and more coming in the years ahead.
Right. I know that the White House in 2 weeks is going to be having a summit on women and girls, and I know that Prevent Connect, Ashley Klein from Prevent Connect will be among the people who will be attending that event.
Yes, well, if folks want to follow us on social media, certainly if you're there, the NSVRC will be exhibiting at that event in D.C., so I think we'll have a lot more to share connected to the council later this month.
Great, and I do want to just highlight that we had a Prevent Connect just recently did have a web conference where we had people talking about economic justice work and addressing the issues of, for example, how restaurant workers get paid sub-minimum wages, and talking about some of the work that can be done to be able to help support economic justice work there in moving forward. So let's draw from our audience. And here, once again, this question you can see this has been real useful. What are the resources that you're familiar with using this strategy of the opportunities for women and girls? We'd love to hear on that. So we're now at the provide opportunities, or O in our passage. So we'd like to hear from our audience. What are some of the pieces that you're using, whether on economic opportunities or empowerment work for women and girls? So I'm waiting for people to start writing in. I know I've got a lot of you here that are doing this, and there's a lot of different programs I think that we can see. As someone pointed out, this is not a new concept, but not been a focus of ours, so thank you for this. It's a way to help remind people of where we can do this. So student leaders, now it's now being right quickly, student leaders in athletic youth, SLAY, which is the counterpart that Rebecca talks about, and someone said they're actually looking into the work into the Restaurant Opportunities Center with their Raise the Bar campaign in Indiana. Girls on the Run for 3rd and 5th graders, and Heart and Soul curriculum for 6th to 8th graders. And Girls Rock, and the Girl Scouts. And there's a lot of really great programming that we see through the Girl Scouts, and Getting Ahead that people are listening. So we'd love to just see some examples of the resources that people are using. Dolores talks about a youth group of activists called Youth Against Rape Culture. And Kim talks about it was never addressed. And so it's great. Thank you for sharing some of these resources. It's great to see all these things. I see Hardy Girls and Healthy Women, which has been featured many times on Prevent Connect web conferences. And thank you for all of this. And it's on us. The federal campaign has been helpful in being able to do some of that. Well, great. So, Kathleen, we're seeing lots of people that are doing this resonates. I think that this frame of looking at opportunities is important. But let's move into our tour now and move to P, where we are now going to be talking about creative protective environments. So, Kathleen, can you discuss this, please?
Okay, sure. So this, again, is our fourth strategy, and this, again, is more of a macro strategy where we're focused on environments. And we're defining environments in 3 different ways, and you'll see that as I go through these approaches. The idea here is creating protective environments. So the 3 approaches. The first is improving safety and monitoring in schools. So the first environment is the school, at the school level. And here the idea is to reduce opportunities for harassment and violence and other aggression by changing something at the physical environment of the school. So the example we give here is shifting boundaries, the building level intervention, which was found to be effective in middle schools in New York City. So it's a combination of different things, one of which is staff monitoring of hotspots on the school campus that are identified by the students. So the idea is that you're adjusting or changing the school environment, the physical environment of the school, to prevent violence and other aggression. So the second approach, establishing and consistently applying workplace policies. Here, the environment we're talking about is the workplace, the organization, organizational climate, or the larger workplace. And the idea here is to address risk factors for sexual violence and create safe and healthy organizational climates or workplaces. So the example we give here are proactive sexual harassment prevention policies and procedures. So the idea here is commitment from top management, zero tolerance for harassment or violence, notification when somebody applies for a job or somebody is hired for a job that there are that it is a harassment-free environment and there's no tolerance for harassment or violence. So there has been some research showing that these types of proactive policies, where it's a top-down thing, is related to less sexual harassment after a year. So that's the second approach. And the third approach is the broader community. So we've had the school environment, the workplace environment, and now we're talking about the community or the neighborhood level. And this is addressing community-level risks through environmental approaches. It can be changing, enacting, or enforcing laws and regulations or policies, changing the physical environment or social consequences for behavior at the neighborhood level. The idea here is to address aspects of the neighborhood and other community settings to make sexual violence less likely. So the example that we identified here for now is alcohol policies. The idea, there's some evidence in the literature that reducing two things, increasing the prices, so reducing access to alcohol by increasing the prices, and reducing the density of alcohol outlets in a community. Those two areas have been shown to be related to lower rates of sexual violence. So there may be other policies. Again, these are all examples under each of these environmental approaches.
Thank you, Kathleen. So Chad and Sally, love to see some of the resources around protective environments.
Right. So this was a section of the page that actually was pretty easy to work on because there was already a lot of great stuff online. So Futures Without Violence has a workplace violence resource center that is very well developed. And when you check it out from our page, you'll find that there's a lot of resources there. We also have a very well developed workplace violence collection that covers both general information and stats, information for employers, and information for advocates. And each of those sections has quite a lot of information. So there's so many resources for this, especially for this particular topic, that there's not a lot to talk about. I'm looking forward to seeing what else people talk about in the text chat when we get to that part. And also, we have some other pieces that Sally's going to talk about around research around alcohol.
Yeah, this focus on the environment is often more challenging for us as a field. And I'm really excited with the work. We've been able to collaborate with so many national organizations on the Workplace Resource Center, and it includes model policies and interactive tools for training for all levels of the workplace. With the NSVRC collection, we have focused in specifically on issues around sexual violence, but also information specific to certain type of work settings. David had mentioned earlier some specific work environments that bring with it certain risks, increased risk for sexual violence. I also want to talk about things that we're hoping to do as we work to continue to share information and build our collective understanding on environmental focused resources. We are going to continue to work diligently to look at the latest research that has come out. Information around alcohol policies has been discussed. We did put out a key findings document that really walks people through the latest research on that area, and mentioning again the issues of greater alcohol outlet density being linked to higher rates of sexual violence. We are also excited about some new partnerships. We are working with several organizations. The Center for Effective Public Policy is leading an effort with funding and support from the Department of Justice's Office of Sex Offender Sentencing, Monitoring, Apprehending, Registering, and Tracking to work with experts, evaluators, and campuses around the United States to tailor and customize a version of shifting boundaries that meets the needs of campus populations. So we're at the very beginning stages in our partnership with Prevent Connect around the work on that project. But again, we'll have some more tools on looking at this pilot study on different adaptations of some proven resources like shifting boundaries. We're also doing additional work looking at situational approaches to prevention. The Boys and Girls Club of America, I think, has been mentioned in the chat along the way. We have a couple pilot projects connected to some of those tools that some folks seem to be familiar with, and we'll be continuing to add links to the research and some of our findings as we're doing some pilot studies.
Great. Well, thank you, Sally, and thank you for mentioning the work that Sally and I are on the committee working with Nan Stein, who developed Shifting Boundaries, to be able to do this, and we're very excited about the work. I do also want to highlight on the alcohol policy that we had a Prevent Connect web conference in 2015, simultaneous to the releasing of the key findings document, discussing some of these alcohol policies. So there's some of these great opportunities that we can see. But let's now, as we talk about protective environments, let's go from our audience. What are some of those resources that you're familiar with, that you're or using on this strategy? What are you doing around creating protective environments? This is one that I think is, as we start moving in the ecology, it's going beyond the skills and beyond the trying to do the norms, but really looking at how do we shift those environments themselves. And so I see an example of doing bullying prevention. There's a lot of work around safe, stable, nurturing environments that has particularly been used using CDC resources, particularly around the child maltreatment prevention. And I think there's been some real exciting work that's been moving there. And so love to just see what resources you're doing around some of these, creating these protective environments and being able to do it. So we see youth community action teams, but a lot, and talking to middle schoolers. I think, though, Kathleen and Chad and Sally, what we want to capture in this is really how this shifts the environment. And indeed, there's many methods to get there, but how do you make those environmental changes? And these are sometimes a little harder to measure, but also become really exciting pieces of doing this. Someone referenced policies to prevent child care settings. I just got someone doing a laugh. I'm assuming that it was, you might want to mute your phone, or I'm going to have to mute everyone's phones in a moment. So great. As I see more people coming in, shifting boundaries is being used as a way of doing that. I'm going to have to mute people's lines. Just 1 second.
All guests have been muted. You can unmute your line by pressing *6.
Hi, thank you very much. We are here, and I just wanted to make sure that we were getting all of that. So thank you very much for doing it. So Kathleen, we're getting down to the fifth element, and the SV of Stop SV, and we're talking about supporting victims or survivors. And I think for those of us who've been focusing on primary prevention, we haven't been thinking about this, but I'm really pleased to see that we're including this, because we know that that this is, to be able to prevent sexual violence, we have to do a full comprehensive action. And while this might not be part of primary prevention efforts, it's essential as part of our comprehensive prevention efforts. So I really applaud having this being in here. So Kathleen, love to see what why this was included and what you have.
Okay, thanks, David. So this, like you said, when prevention doesn't work, then we have to have supports for victims and survivors to lessen harm. So this, as you said, we see this as part of the comprehensive package. And this is our fifth strategy. It's providing services and treatment to support victims and survivors to lessen harms. So we're highlighting three approaches. Two are on the slide here. The first is victim-centered treatment, and the second, psychological treatment for victims of sexual violence to reduce negative impacts of sexual violence on emotional health. So first, the victim-centered services. Here we list as an example crisis intervention, medical and legal advocacy, access to community resources. These are formal services to help improve outcomes for survivors and mitigate long-term negative health consequences. So some examples: support groups, crisis intervention, as I said, medical and legal advocacy. There has been some evidence that these lead to increased reporting, they lead to increased medical care and decreased feelings of distress. So that's that first approach. And then the second approach, treatment for sexual violence victims. What we mean here is evidence-based psychological interventions. So they're conducted in therapeutic settings, and the idea is to improve psychological health of victims. And three different examples here: trauma-focused cognitive behavioral therapy, and then there's cognitive processing therapy and prolonged exposure therapy. These types of programs reduce symptoms. They've been shown to reduce symptoms like depression and PTSD, and at a long follow-up, like 60 years later. So they've been shown to be pretty effective. And then moving to the third approach under this last strategy, this third approach is treatment for at-risk children and their families. And so this includes treatment for sex offending. So these approaches are usually addressing not just the individual child or adolescent, but also the family, the school, the community, and all these factors that contribute to sex offending among high-risk youth. So the examples here, multi-systemic therapy, MST, problem sexual behavior, and then children with problematic sexual behavior, cognitive behavioral treatment program. I know that's a mouthful. Some of these types of programs have been shown to be impactful in different ways. For example, one study found that these types of programs led to fewer arrests for sexual crimes after 8 years. That's a long follow-up. There are other programs, these are just a few examples of these types of programs that are focused on at-risk children and have components that are dealing with not just the child, like I said, but also their peer relationships, their parent-child relationships, and other relationships through family therapy.
Well, thank you. So now, Sally and Chad, what are some of the resources that you would want to highlight? Hello? Oh, you might.
Yep, I just unmuted myself. Sorry about that. We're really honored to be able to take some time to talk about the value of community-based services for survivors and their loved ones. We have learned so much over the last few decades about trauma and about our brain. And we have put together a collection of resources looking at trauma-informed practices. And so with these practices, we want to support folks that are understanding how brains and bodies respond to violence, and looking not only at the very promising treatment programs that are developing and the connection between our advocacy efforts and longer-term mental health services we make sure are available to survivors in our communities, but also just looking at the environments that we are creating. Someone mentioned in the chat needing to understand that survivors are part of every community group of participants, training, and that really bringing this holistic trauma-informed approach is really important to making all of our intervention and prevention efforts more holistic and more beneficial to our community members. We've developed a guide based on things that we have learned from the National Sexual Assault Demonstration Initiative, which was the first national scope demonstration initiative that we are just finishing up this month with sites. This was our first kind of lessons learned tool, this Building Cultures of Care document to help organizations look at what do their policies look like, what do their services look like, what does their environment within their office look like to be able to provide more effective services to sexual assault survivors. And we'll be adding more to a toolkit around this area. I also wanted to let folks know I've posted a link to some specific tools for trauma-informed practice across the lifespan. That's also included in that main resource page that we've been talking about throughout. We are also engaging in a partnership with the Office for Victims of Crime to infuse more information about trauma-informed services into the National START Toolkit, which is an online toolkit that helps communities to develop and sustain sexual assault response teams. This is a huge undertaking. We are just finished up a national needs assessment, and we'll be working on some updates to the toolkit over the next year, so that we'll have that available probably in early 2018 for folks. But again, trying to make connections and bridges across all of the sectors of folks that are providing services to sexual assault survivors is at the forefront for us, and being able to weave in the information that we have about community responsibility and connection, and also how we can build a strong support system for survivors in the communities that they are in.
Great. Well, thank you, Sally, for sharing that. And so once again, I'm sure no one is going to be surprised what the next question I'm going to ask is, what resources are you familiar with using this strategy and approaches? So we'd like to just get a sense of what people are doing. And Carol raises a really good point about bridging sexual violence and domestic violence with child sexual abuse prevention programs and treatments. I'd love to hear from people about how they're doing that, bridging those resources. But it's, as we know, there are survivors in all audiences, and that we want to be attentive to that, and that sometimes stopping someone who has been abused who has been abused can really create change for the next generations and people that are involved. Vinny talks about a trauma-informed committee in their state health department to improve contract services and internal processes that will reduce harmful impacts on recipients of public health services. And a certification course for, Kim talks about over in New Mexico, a 2-week certification course for a therapist treating youth with sexual behavior problems. And there's a lot about trauma-informed therapy practices. And so I see more lists coming in. Thank you much. And Barry talks about, within Expect Respect, a school-based support group for youth exposed to violence, which is another program that I'm very excited about. So thank you so much for sharing this. Kathleen, we've gone through the 5 strategies, but I think we want to talk a little bit about who gets involved in this and a little bit about sectoral. So can you just talk briefly about sectorial involvement, then I want to go to our audience and think about this. So Kathleen, why is it important to involve many sectors?
Yes, so there are numerous sectors that can get involved in this work, and so like I said earlier, it's not just public health that we were thinking of when we were developing this. There's a list here of the sectors that we think may be involved, and at the end of the package, we do have a table that identifies for the strategies and approaches which sector might be the lead. So there's many strategies and approaches where there'd be sectors working together. and one may take the lead, but it may be also working across sectors. I think these strategies, some of these strategies are for public health, because public health may be well positioned to bring leadership and resources. But there are other strategies in here that other sectors, such as business, labor, particular programs like the workplace policies, for example, they may be in a better position to take the lead. So I think collectively, public health, education, justice, healthcare, social services, et cetera, all of these organizations that comprise the civil society sector, the other sectors like rape crisis centers that are in the civil society sector, faith-based, all these sectors that are on the slide, they can all work together to prevent and to implement these strategies and approaches.
Well, Kathleen, let's go for our audience. What sectors do you think can be able to use this technical college package to be able to engage in sexual violence prevention? So we'd love to hear who you've been working with or who you want to be working with. So go ahead, and we're going to put this in. Right now, college campuses is a theme that's coming up already because it's indeed a place where we need to see much. And so schools, I see, has immediately come up right away. Youth shelters, group homes. So sometimes within the nonprofit sector, we're seeing a wide range of things. Our CCR, Coordinated Community Response Team. So there's a lot of churches and faith communities, summer camps, mental health facilities, school-based health clinics, child care centers, schools, colleges, churches, mental health agencies. I'm noticing some themes. Military based in communities. So I'm seeing some of these ideas that are coming up with sectors that we can be involved. And then those that are involved in the coalitions and the sexual assault response teams. And I'm seeing some of these common themes moving forward. And as Kathleen had said, here's a list that the CDC had put together of just some of the sectors. And this is not an exhaustive list by any way. And I think that it's part of I think it's important for us that who are participating today is to think about how this tool, the technical package, can be an important tool for involving the other sectors and being able to help them be able to identify where they can work with others and where they can be able to take action to be able to move forward in doing this in all of our work. So the sectoral involvement is very important. So we're coming, Kathleen, I know you have the last couple comments, and I want to talk about how people plan on using this. So why don't you talk a little bit about monitoring and evaluation, just briefly.
Okay. So as I mentioned earlier in the webinar, monitoring and evaluation are necessary components for this technical package for a couple of reasons. For one, timely and reliable data are necessary to monitor the extent of the problem through surveillance and to evaluate the impact of our prevention efforts so we can know what has evidence of effectiveness. The data, as you know, are also necessary for program implementation because planning, implementation, and assessment all rely on accurate measures of the problem.
Great. So with that, let's think, Kathleen, about what are some of your thoughts about how people would be using this technical package?
Yes, and I want to start by saying in terms of implementing this package, we are currently working on some general implementation guidance at CDC with some components that are specific to this technical package. So that's our next phase for this work. But in the meantime, here are some questions to consider. If you are already engaged in sexual violence prevention, you may want to think about whether your current efforts align with the information included in this package, and if there are other ways, are there ways the technical package can be used to advance your work. And then if you're not yet engaged in sexual violence prevention, you may want to consider using this package to plan and prioritize your efforts. So we do, at the website at the bottom of this slide, we have some planning and implementation resources available at that link.
Great, and that veto violence, which we recommended, Ashley also did put that into the chat, so if you want to get there. So now that thank you, Kathleen, this has been really great, and thank you, Chad and Sally, for highlighting some of the resources. So now I want to go back to our audience in the last few minutes and think about this. How do you plan to use this technical package in your sexual violence prevention work? So I'd like to get a sense from you, what are those next steps you're going to take? What's the take-home message from here? What's some type of way that you're going to be incorporating this? Because for us, we want this to be actionable and supporting how we're going to strengthen our work. So I want everyone to think about and write in the text chat, what are some of the ways that you will be able to use this? And might be internal within your organization. It might be how you're going to partner with others. But I'd love to just see the ideas that are going to come up and emerge of the work. So working with Department of Education, I'm assuming not Department of Energy, in providing model standards and guidance to local schools, evaluate current efforts and increase partnerships. South Dakota has used the technical package to decide workshops for their statewide sexual assault conference already. So yeah, if you're that 4% who's already done this, make sure you write this down. Implement new methods of prevention in our school, with our schools and medical area, sharing it with our RPE team, helping implement more focus on sexual violence in our prevention efforts, guide and frame prevention work at a state coalition level, expand programs to include 5 elements, add resources to our school prevention team toolkit. There are several resources that I'm going to access and use in my work. They're really interested in the Futures Toolkit on Changing School Culture. We want to work more with schools in the district, increase partnerships with more sectors in their community. Hannah talks about. Love to hear what sectors you're thinking about trying to be able to connect with. Increase allyship with there. Do you have a link for a link or resources if you're already working with sexual assault victims? Karen, I'm not exactly sure what you're asking for. If you can get a little more clarity, that would be helpful. Infuse this concept in our sexual health conference this fall. That's great to be able to do. More resources for prevention education. And so just more, I'd love to see what people are writing down. So Kathleen, I'm seeing a lot of people that are talking about some of the ways that they're going to engage new partners and also begin to think forward. Karen talks about training victim advocates and prevention specialists to change the culture at the national and international level. Law enforcement, including the FBI. So Karen is thinking broad and specific at the same time. So Kathleen, I'm noticing a lot of actions that people are taking. One of the things that we'll be doing in Prevent Connect in our evaluation is we'll be asking how you're using this, and we will be following up with a selected number of you just because we want to be able to see how these tools become useful in improving your sexual violence prevention practice. I do encourage you that as this moves on, we have these great, and Kathleen, I guess this is the final slide that was from you, which I think is just that it's a tool that helps states and communities take advantage of the best available evidence to inform and guide prevention decision makings as we're making decisions within our states, and our local communities and throughout this country. And I know we have people that are beyond this country who joined us today. So I really want to highlight the resources. This is a link to the technical package. The Stop SV infographic is now on the Prevent. It just became available today, so now I put that link on the Prevent Connect page, and I encourage you to join the National Sexual Violence Resource Center's Stop SV resource page, which will be growing as we move forward. So I want to really thank Jim Mercy and Kathleen Basile from the Centers for Disease Control and Prevention for joining us today, and also for Sally Lasky and Chad Sniffen from the National Sexual Violence Resource Center. And I want to particularly thank Ashley Klein from Prevent Connect, who has been busy behind the scenes on this session. And most of all, I want to thank all of you in our audience, because it is the audience that makes the difference of being able to share resources and move forward. I see this as a tool that we will be continuing to use at Prevent Connect in guiding our work in the next year. So I want to thank all of you. So with that, I want to thank, we only have a couple minutes. If anyone has any last questions or comments, you can put that in. But I want to thank you for joining us for today's web conference. I think this was a really great, vibrant discussion, and we will be looking at these in greater depth in the future, and please share those resources. So thank you so much. And I have the unusual thing of ending, I think it's going to be 2 minutes early. So thank you all for today's Prevent Connect web conference. This will conclude the recorded part of the session. We will keep the chat open for a few minutes if people want to have any questions or comments there. Thank you all for joining us.